Okay. Good morning, everybody, and thank you very much. Welcome to this launch event for this research, and thank you for giving up your time to celebrate this launch with us. The format for today's session will be brief. Myself and my colleague, Dr. Gladys Nyachao, will be speaking for the next 30 minutes. We'll then have some time for questions and answers. And if it's okay with you, if as we go, you could enter questions in the chat, then we can use that as a reference point to answer questions at the end of the presentation. So it's been my pleasure to have worked on this project for a number of years now, since 2021. We've been working to set up the National Helmet Wearing Coalition in Kenya. And I'd like to take this opportunity to say a big thank you to the FIA Foundation, not only for funding the project, but also for their time and expertise, which has supported us hugely as we've implemented this initiative. The coalition started in 2021. We started with 20 members. That's 20 representatives from different organizations and agencies. And since then, we've grown in numbers. What we do is we meet quarterly in Kenya to discuss and identify priority areas of action, to share the work that we all do in this field, but also, I guess, the key function of the coalition is to encourage collaboration and to look for opportunities to work together. Since 2021, we've been implementing various pilot projects with a view to presenting models or approaches which are scalable. Our main focus areas and the main focus of these projects so far has been to improve the delivery of road safety training to motorcycle taxi riders, to strengthen enforcement, particularly with a focus on the county government officials' role in actually providing that enforcement, to work with SACCOs or rider associations to improve access to quality helmets, and also to raise awareness around helmet safety with a particular target on motorcycle users, so riders and pillion passengers. This research today probably represents one of the most important pieces of work that we've done to date. And I'd like to also thank Multimedia University of Kenya, Safeway Rightway, a team of amazing research assistants, and also the riders that participated in the study as well. We believe it's the first time that, we believe it's the first research that looks into the healthcare costs relating to motorcycle crashes specific to Kenya. And obviously, it highlights the importance of developing solutions relevant to the context. And that context is rapidly evolving in Kenya. And I'm going to just show you a quick slide which summarizes some of the key points around that context. As we all know, I think, two-wheelers, motorized two-wheelers, and the growth of motorized two-wheelers in Kenya has been rapid, particularly since 2008. And it's probably no exaggeration to say that it's revolutionized mobility for communities in both rural and urban areas. There are reported 2.3 million registered boda bodas nationwide in Kenya at the moment. And these 2.3 million motorcycle taxis provide more than 22 million journeys, which is indicative of the popularity of this particular mode of transport. It's obviously a huge source, an important source of employment for largely young men, but it does come at a safety cost. We saw last year, 2023, a big rise in the proportion of road traffic fatalities being motorcycle related. That proportion was in 2023, 35% of road traffic fatalities. And we've seen numbers rise between January and March this year compared to last year. Again, that proportion of motorcycle-related fatalities is around 35% at the moment. What we see on the streets is helmet prevalence is low, particularly amongst riders, but even lower still for passengers, pillion passengers. Despite that, the legislation in Kenya is judged to be robust. And actually, Kenya is in quite a unique position in Africa in that it has a helmet standard in place. Now, some argue that that standard could be higher. Of course, there are higher international standards that exist out there, but it's important, I think, when we talk about the helmet standard to recognize the challenges on the ground. This standard has been in place since 2012, and yet the helmet market in Kenya is still dominated by substandard helmets which don't fully protect the motorcyclists. Our stance as a coalition has been to work with the standard that exists currently, to build the capacity within government, within the enforcement authorities to implement this standard before we consider moving to an improved standard. And I think one thing we agree on as a coalition is that to achieve this, we need to establish sort of better testing capacity within Kenya. One success which we achieved with the support of the FIA Foundation as a coalition was linked to the forthcoming road safety action plan in Kenya, which is about to be launched, which includes now as a target to establish a helmet testing lab in Kenya by 2027. This research constitutes our first steps towards a push to achieving this. We're aiming to do that this year, and we're seeking funding, a relatively small amount of funding, $350,000 to establish a helmet testing lab and to monitor its impact. I'm going to pass on to Dr. Gladys Nyachae now, but before I do, I'd just like to say before that this research does not seek to attribute any particular blame to any one group of people. Motorcycle crashes have many different causes. In some cases, the motorcycle rider is to blame, but in many other cases, other modes of transport are to blame. So I just wanted to say that point before we go forward. And at this stage, I would like to hand over to Dr. Gladys to take us through the high-level findings of the research. And over to you, Dr. Gladys.
Okay. Thank you very much, Sam, for introducing the authors and even giving the context of this study. That gives me an easier time of just going straight to the research. I will start by indicating that we used 3 approaches in coming up with the findings of this research. The first approach was we used observational study. We also used records analysis and personal testimonies. For observational study, we focused on 5 high-risk roads in Kenya. In Nairobi, that is Mombasa Road, Kangundo Road, Outer Ring Road, Jogoo Road, and Thika Road. And on hospital records, we collected this information from 2 public hospitals. We actually intended to have 3. One would have been private, but that was not possible. So for testimonies, of course, we got from the people who have been involved in these accidents. So next. to the key findings. Okay, we'll start by giving the general road safety data information. This is for the period of May 2022 to October 2023, which was the period of this study. So in that period of time, almost 10,000 people were affected by these crashes. And of those, 56% incurred serious injuries, while 24% were fatalities, and 20% had slight injuries. Of all, 74% information that I'm giving you are fatalities among the riders. 26% were passengers. And for serious injuries, we had 62% were riders. And the data shows that passengers were more likely than riders to incur slight injuries. So as you can see in the slide here, the blue is representing the operators, and you can see they are higher than this other color that is representing the users. So in all categories, motorcycle operators or riders were more affected. Next. Next slide, please. So under the observation study, which I've already talked about, we also had the FGDs. And in targeting these 5 roads, the study results shows that 63% of the riders were actually using helmets, while only 15% of the passengers were seen to use helmets. And the primary motivation of the riders who were using helmets was they just wore them when there was strict enforcement. Therefore, this means that they didn't really consider their safety in this case. The riders, the observations made near locations where you could expect enforcement, there was higher helmet prevalence. The concerns that these riders were talking about was the helmets limited visibility and ability to hear, and also they complained about the heat. And this could actually be attributed to the type of helmets they were using. And that's why we advocate for quality helmets. On the other side of the passengers, of course, there were very few that were using helmets. And the reasons that they were giving were they had concerns of hygiene, aesthetics, and also they complained that they were not given that extra helmet to wear. So therefore, and to encourage that the riders have an extra helmet so that we don't have such complaints, and at least the passengers are also covered. Next slide, please. Okay, now I'll just give a summary. Going to the hospital records data for the same period, that is 18 months, we looked into almost 1,000 records. And of the records that we looked at, 91% were male, and the average age was 31 years old. In the 992 cases, 94% patients were actually discharged alive, but the other 6% they died while receiving treatment. And of those, the 62% were border operators, not passengers, of course. That's what we are trying to emphasize. And the most common injury types were head injuries at 35%, followed closely by limb injuries at 34%. And there is this category that suffered multiple injuries, that was 24%. As seen, high levels of head injuries was attributed to low helmet preference and substandard helmets, as we'll continue seeing in these results. Next slide, please. Okay. Still under hospital record data I'd like to say that we could not get all this information that we actually required. So in this case, out of the 992 records, only 749 contained the information under the hospital stay. So 30% of the patients had a short stay of up to 24 hours, while 55% stayed up to 30 days, 12% stayed in hospital for between 1 to 2 months, And the study found that the mean length of hospital stay was 18 days, and the longest stay was 406 days. Now, this one just gives you an idea of how much it would cost a person socially and economically when they get involved in these motorcycle accidents. And that on the hospital treatment cost, all hospital costs, of course, were passed to the patient, but there were a few cases that had NHIF, which actually helped a lot, but most of them were paying from out of their pockets. And in some instances, for example, we found a few cases in Mama Lucy, they provided this treatment for free, especially for very, very needy cases as they judged. So the mean cost of patients with multiple injuries was the highest, where they have injuries of the head and the rest of the body. So you can tell from this analysis that the cost of this accident is quite high, and it has adverse effects for the family and the community. Thank you. Next. Next slide, please. So we'll just look at maybe 2 case studies that were involved in this study. So we know that when we talk about motorcycle accidents, we really think that they are so far away from us, like they do not have a face on it. So this study is more important because it puts a face. We can see the people we are talking about and what they are going through. So for Caleb, who is a 45 years old boda rider, he was involved in an accident in 2022 around the Two Rivers area. For those who are in Nairobi would know that. He had a head-on collision with a car that was overtaking. And as Sam said, it's not always that these boda riders are the ones that cause these accidents. They are victims just like any other person on the road. So we need to look at it very objectively. We should not judge because we actually do not know what actually happens. So this person was doing their job, but they got into an accident. He was actually taken to hospital, and they thought that the head injury was the main problem when he went to hospital. Although actually, when the accident occurred, the helmet, as you can see, was smashed. And as much as he got injured, probably the helmet saved his life. And he was taken to hospital. Eventually, they discovered that the knee had a problem. He lost he had to have a replacement of the kneecap. And he stayed in the hospital for the next 3 months. And you can see from the information there is that he spent above $2,000. And he was lucky that he had NHIF. There are some cases that do not have such. So Caleb, for the following 20 months, was unable to actually cater for his family. He lost his livelihood, as we say. And were it not for a shop that he had set up earlier, probably the family would really have suffered. And this is a family man. So when you think of a boda rider, think of a person. Think of a person with a family who is trying to earn a living and not just a criminal. We need to change our attitude and see these people as people. Next. The next case study. Okay, the next case study is a 30-year-old called Andrew. Andrew was involved, has been working as a motorcycle rider from 2014, and he got into an accident at Kibera, and were it not, according to him, were it not for the helmet that he was using, probably he would have been history by now. But he got a very serious injury on the knee, and currently he's on a prosthetic limb. He lost his leg, so he was put on a prosthetic limb, which he's now working with. He changed his career and went into being a barber because of the accident. And as you can see, it cost up to $15,000 US dollars. Money that, if you look at how much the boda riders earn in a day, would mean like more than 4 years and a half of salary. This family had to take care of other costs. So this one becomes a very important and urgent need to take care of this issue. So with the fact that he lost his leg, his family also got separated in terms of not divorce, of course. They had to move to the rural areas because he was not able to take care of them. And this brings to the fore the social impact and the social effects that we never really look at. Here is a father who cannot stay with their family, the child who is losing their father in terms of distance, just because they got into this accident. So this is important in terms of looking at this as a real social problem in the society currently. So next slide. And I think the next slide is on recommendations. This study, therefore, recommends the following. First, to improve record keeping at the hospitals. During our study, we discovered that, of course, information was not digitalized as much as they were now in the process of digitalizing. The other problem was the lack of standards. Where the two hospitals that we visited are public hospitals. They should be capturing the same information in the same manner, but they were not. So this becomes a recommendation that for us to get easier access, it was actually very hard to put this together because it is not digitalized. You can imagine going through all the files up to 900. So the other recommendation is that data collection at the crash scene is totally important. As we speak, we are not able to tell whether the people that are recorded as having head injuries or died of head injuries or such were actually wearing helmets or not. So such data would help us know the probable cause of this and also help in advancing interventions in the same area. Of course, more research is needed because research helps in informing policy and actually appreciating the problem that we have in society, especially for now this road safety. We need affordable access to equipment. As you see, the border riders actually earn not very much, and they may not prioritize safety if they're not able to cater for their other primary needs. So stakeholders, we need to start talking about how do we make quality helmets available, or how do we make people get these helmets without spending so much. There is also need for training because the focus group discussions showed that there was little appreciation of the importance of wearing a standard helmet. There is need to be trained on that. There is need also to have a distinction between good and bad helmets. And without knowing a bad or a good helmet, it will be hard to enforce because people will buy any helmet. And on adding to that, the following point is that very important to have a helmet testing capacity to be able to know that we are actually using a good helmet. And since some said we already have the standards, we only need a testing lab to be able to accomplish this. There is also need for enforcement. It has been emphasized before. We have legislation is there, but there is a little, something is being done, but it's more reactive. So we should be more proactive. There is also need for SACCOs to be strengthened. The requirement in Samia, okay, in 2022, indicated that all riders needed to be in SACCOs, but this need to be strengthened so that they can self-organize and self-enforce in matters safety. Helmet safety sensitization, I do not want to repeat that. For passengers and riders, sometimes we forget that these passengers also need to be sensitized on the importance of a safe helmet. So this needs to be done. And also, in all this to happen, we need to work together. For example, private sector needs to be more accountable, needs to be able to provide innovative ideas on how we can deal with this situation, because when the riders and the passengers suffer, we all suffer as a community. So with that, I'll take this back to Sam. Thank you very much.
Thank you very much, Dr. Gladys. So I'm just trying to find my camera. Um, Thank you very much for that. I should say to everybody here that that is a very high level overview of the findings of the research, and that we would encourage you to get a copy of the research if you possibly can, which are available, and you'll see on the final slide after the questions and answers, which guides you towards, there are two websites, the FIA Foundation's website and the TransAid website, which you can find this report. And I'm sure other sources as well. I would just like to maybe discuss a couple of the recommendations in a little bit more detail. You can see in the middle there the helmet testing capacity, which we've already mentioned, but that street level enforcement is an absolute key issue as well. Because I think what we see on the streets, and this is through discussions with the MPS as well in Kenya, is not necessarily a helmet sort of prevalence being a priority in terms of street level enforcement. Yes, we can see from the research that Dr. Gladys presented that sort of stronger enforcement is a key driver in making a rider decide whether or not to wear a helmet through the observational study. But that street level enforcement does at the moment sort of occur in spikes, high sort of high levels of intense enforcement followed by long periods of perhaps lower level enforcement. And that role for the SACOs is absolutely important. As Dr. Gladys said, there was a move in 2022 whereby all riders are now required to be a member of a SACO, and that SACO and its capacity to enforce its own riders is an important factor, and absolutely those SACOs need support to actually build their capacity. We have a number of questions which we're going to go into now, and I'm going to distribute these, I hope you don't mind, Dr. Gladys, between yourself and me. The first question I'm going to point to is one in the chat box, and this is to you, Dr. Gladys. And it's a very quick question. I think you might have covered it in the research, but the question is, how was the data collected for the motorcycle crashes?
Okay, thank you very much. I think it's Patel who has asked that question.
Correct.
As I started, we had three approaches. One of the approaches that we used to collect the information was hospital records. So we went through hospital records file by file to get the information that we needed. That is what we captured, and that was we analyzed, and the findings are as we presented. So we used hospital records. Thank you.
Thank you, guys. I should say, having been part of that data collection for only a day or two, massive amount of respect to the research assistants who spent many hours in very small rooms in hospitals sifting through piles and piles of paper. That data, I think you can see from this research, is a major limitation and access to that data and the way that data is recorded, which is a little inconsistent in places. So there's a definite improvement there that would help facilitate more research going forward. There's another question here. Has work or discussions already started in country to try to set up the helmet testing lab? And my response to that is absolutely. This has been on our agenda as a coalition since, well, actually the whole of last year. And we have moved forward. We know what a helmet testing lab costs now. Incidentally, there are only two companies in the world that actually produce this equipment. So our options are slightly limited in terms of purchasing that equipment, but we have the quotes. We know how much we're looking for funding wise, as I said, somewhere in the region of $350,000 US. And we have prepared a proposal, and we have started pitching to donors such as the World Bank, the African Development Bank, the EU delegation, and various foundations as well. And we hope to have success at that. And of course, there's another factor here to take into account. Obviously, the objective of building helmet testing capacity is to stem the flow of these counterfeit substandard helmets, which are largely coming in from overseas into Kenya. And what we're trying to do by improving helmet testing capacity is to support Kenyan helmet manufacturing. There is certainly one Kenyan helmet manufacturers which came to light in 2022, I think, or maybe 2021. And they have a growing proportion of the market there. They're under more scrutiny. They receive visits from the Kenyan Bureau of Standards and so forth. And we would like to support them to grow their stake in the market as we move forward, with confidence that they are producing and manufacturing quality helmets. And of course, by supporting Kenya industry, we're supporting the growth of that industry and more jobs for Kenyans as well. The next question I'm going to go to is from James Donnan. What are the barriers to persuading riders that helmet wearing makes sense? If enforcement is not a real incentive, is it the cost of helmets which acts as a barrier? I'm going to sort of try and answer this slightly and then maybe pass to you, Dr. Gladys. There are a number of reasons, James, as to why people aren't wearing helmets. As I said a minute ago, the main reason for wearing a helmet is enforcement. So the more visible enforcement there is out there on the streets, the higher the numbers of riders which are going to be wearing helmets. But there are various concerns, and I think you can divide those concerns by rider and by passenger. They're slightly different. Riders are more concerned about the limitations around visibility and the limitations around being able to hear wearing a helmet, which, of course, in a robust testing regime, those issues within helmets are tested and so that they're not compromised at all. From a passenger point of view, where we see much lower numbers of helmet wearing, the legislation actually points to the responsibility lies with the rider to provide the helmet to the passenger, which in effect relinquishes the responsibility of the passenger to actually wear a helmet. There's always sort of a recourse to, well, the rider didn't provide me with one. In addition to that, there are concerns mainly communicated by passengers linked to hygiene. Obviously, helmets which are passed to them from the rider are likely to be worn by multiple people. It's probably a factor which was exacerbated during the COVID pandemic. And aesthetic reasons, hairstyles, and so forth. So they're the main barriers. And I should actually make reference to a project which the coalition has done as a side project, which has been led by an organization called Safeway Rightway, which is about developing short films to share with riders via social media, to myth bust, to bust some of the myths around the reasons why people have decided not to wear helmets. And I don't know if Vincent Wandera is on the call, but if he could pop in, if he could pop in a link to one of those videos, that would be amazing. Dr. Gladys, have you got anything else to add to that around riders not wearing helmets?
Yes, I would like to say that also not wearing a helmet is kind of a culture. People have been socialized to not wearing a helmet because of law enforcement, and probably nothing has happened to them. So they may not see the risk of not wearing a helmet, and therefore that is why training and education would be more important to keep reminding them that they need to use helmets. So lack of knowledge and appreciation of the repercussions is one key barrier in the use of helmets. Thank you.
Thank you, Dr. Gladys. Comment from Mr. Patel about Mombasa and the climate there. Obviously, it's very hot, sea level, and there are various issues around wearing helmets linked to the climate. Absolutely, and this links to another comment as well, actually, about the design of helmets. I think going forward, the design of helmets does need to accommodate climatic issues and concerns about the heat and so forth. I think there have been efforts to make to do something about this. The FIA Foundation, as part of their Safe and Affordable Helmet Initiative, did produce a helmet which had sort of vents at the top, which provided sort of some respite from the heat for riders. Although I believe many of the riders actually mentioned the fact that what's the word? The wind factor coming in through the vents at the top was a further barrier to hearing, but that's something maybe we could explore going forward in the future. I'm going to push another question to yourself, Dr. Gladys. How do people pay these huge amounts? I think this relates to the case studies, which we took a bit of a deep dive into how much riders were actually paying, compared to obviously the daily salaries that they have as well. Big challenge for them, I imagine.
Some I didn't get you.
Oh, sorry.
Could you repeat?
It was related to the cost that we reported some of the riders are paying for healthcare costs. You know, sometimes in the thousands of dollars realm, particularly in a case where they're getting between $10 and $15 gross every day from riding the bike. How do riders deal with these costs, in your opinion?
Okay. Thank you very much. And that is the biggest challenge. For different hospitals, we found that some are treated and let to go, but in some incidences, sometimes they are retained. But most of the time, for these riders to raise these funds, they have to use their own savings. Like in one of the case studies, the family had to pay, and therefore the family has to source for this money. So then the riders are encouraged to get insurance, and also to try to be safe, because some of these costs are very high and they live in debt for a very long time. So it's a big challenge for even the healthcare units, because now if they don't pay, then they can't be kept forever. Then the hospitals must just waiver it, just leave it, and that means a lot of economic economic losses for the hospitals that we are talking about. Sam, you can add something if you have.
Thank you. Yeah, I'll add to that. As Dr. Gladys said, a lot of it's through loans from family and friends, which sort of potentially drives families into deeper and deeper debt. But we made mention in the research to the National Health Insurance Fund, which for the lucky few that do subscribe to that fund, which for anybody that doesn't know is a government-run scheme, which is aimed at, it's a subscription scheme where you pay a monthly fee with the expectation that some of the health costs from an injury or a serious injury is relating to a motorcycle crash or anything else are covered by this scheme. So for the lucky few that do subscribe to the National Health Insurance Fund, some or all of the costs may be covered. There's the loans from family and friends. In many cases, and you can see from some of there were more case studies actually in the report, you can see that riders have taken it upon themselves to diversify their income sources. Andrew Benson, who we presented there, actually has started up a hairdressing salon in Kibera. So, you know, lots of different strategies there. And in some cases, again, the research points to this, health facilities have the power to sort of a discretionary power to waive some of the fees in cases where they consider there is an inability to pay on the part of the person injured. There's a question here, Dr. Gladys, about crash data. The injury data is very important. Is there any reliable death due to motorcycle crashes data, or data broken down by head injury? I think what they're trying to get at is, you know, we've presented what the proportion of head injuries is as a result of a motorcycle crash. Is there any more detailed data breakdown as to who survive, you know, people with head injuries surviving and not surviving? Not sure if you understand that.
Okay, I'll say something and I know you'll add to that.
Okay.
That's a difficult question because of the nature of data. As Sam already said, we have a challenge in what data we had a challenge in what data we could actually get. And what we presented there came from the records of 992 cases that we were able to review. And beyond that, it is not easy to actually now relate again, because the ones that were indicating head injuries, we lost about 6% of the data that we reviewed, of the files that we reviewed. So 94% we can say came out alive, but in that there are some that had head injuries and others did not have head injuries. So this is the type of challenge we are talking about, and that is why we need to be digitalized, to be standardized, and to have information that is captured that can direct us in terms of this died because of this, or this injury was actually because of this. This person had a helmet, did not have a helmet. So that is the type of data that we actually seek to get in future. Sam, you can add something.
I've not got much to add to that, really. I think you're right, Dr. Gladys. It's that data is not there. We did actually interview representatives within the Ministry of Health, the head of non-communicable diseases, and they were very open in saying that at the very basic level, they don't even have the data in terms of the proportion or the health costs related to the proportion of road crash fatalities, which is linked to motorcycles. They have overall data, but unfortunately, yeah, the detail is really not there. But again, this is a call to that fact, the need for more data, which will in turn spur more research. There's an interesting question here. How much is the cost of a standard helmet against their earnings? So we can see from the case studies that their earnings are gross on average between 10 and 15 US dollars a day. What we see in terms of a poor quality helmet bought on the street in Kenyan shillings, you can buy one for approximately 300 or 400 Kenyan shillings. And it's only, and this is one of the reasons which we're supportive of the Kenyan helmet manufacturing industry. Obviously, the cost being a major factor, or a factor you would assume it to be to actually purchasing a quality helmet. But for a quality helmet made in Kenya, we're talking anything from 700 Kenyan shillings and upwards. There are various models. So I think my own personal opinion is that remains within the realms of affordability for riders. And obviously, if we talk about working with SACCOs as an outlet for those helmets, maybe we can start to think about various different payment mechanisms that can be put in place to make it easier for riders to purchase helmets bit by bit. And just before we proceed, SACCOs, by the way, are effectively, they're saving, they're cooperatives or rider associations, which as Dr. Gladys mentioned, is a requirement now for all riders in Kenya to be a member of. Question for you, Dr. Gladys. How about corruption of the traffic police? Did you establish the role this can play in compliancy of wearing helmets?
Okay, the study did not look at that specifically, but of course that would have an effect on how and whether the helmet will be used. If you are arrested and then you are able to bribe and you can get your way, then it will encourage the non-use of helmets. I think overall corruption is a problem that would affect any sector, and this sector would of course be affected by that. If maybe, I don't know whether, I think I've seen Vincent. Vincent took part in some of the focus group discussions. Maybe you can chip in and say something about that, if you allow some.
Yeah, of course.
Vincent is part of the, he was also an author in this work, so can say something.
Thank you, Gladys. Yes, indeed, we didn't focus on specifically enforcement and as impacted by corruption, but it did come out when we discussed it with the riders. A lot of them felt that when the crackdowns are launched by the police, the focus is really not to ensure that the riders wear the helmets, but really as a source of income for the police, extra income for the police. So it did come up, but it was not a focus. Thank you.
Thank you, Vincent. Very clearly worded. Just returning to some of the comments and questions made in the chat. There's a comment from Raphael. If helmets are affordable and easily accessible, there is a possibility for frequent travelers to purchase their own. And absolutely, and I think this is a consideration in terms of looking at the current legislation, which, as I mentioned, does put the onus on the rider in having to provide the helmet to their passenger, which does, as you mentioned, provide issues around hygiene and so forth, which is a concern. But it also exonerates the passenger from responsibility effectively. So I know in other countries, this sort of legislative sort of clause doesn't exist, and the onus is far more on the passenger. So yes, certainly something to consider as we move forward. And one of the coalition's goals is to look at the legislation to identify areas such as this one which could be improved in future. Mr. Patel, the government can learn from Rwanda's experience and develop a regulatory policy framework that ensures safety, security, and compliance. Firstly, Mr. Patel, I'd love to get your contact details, because you've obviously done a lot of work on this, and I would love to speak to you. But absolutely, I think if we look at sort of other countries in the region, we can see areas where good is happening, but areas where improvements need to be made. And one of our objectives as a coalition going forward this year is to initiate that dialogue on a regional basis, to learn from each other, and to start that conversation and to develop, hopefully with the EAC, an approach which starts to roll out initiatives such as this throughout the region. Yes, Rwanda's experience is very different, where we see almost 100%, in fact, pretty much close to 100% compliance in terms of helmet wearing there. Although there is an issue there with helmet quality. There is no helmet standard at the moment in Rwanda, which I know the FIA Foundation are also working on as well. That at the oh, there's one final question. Will similar research be conducted in other countries utilizing motorcycles, perhaps in West Africa? Absolutely. I think I'm hoping this is just the start of it. We've seen a rapid growth in the last 2 decades in East Africa, particularly in Uganda, Kenya, and Tanzania. But we're also seeing a rapid growth in West Africa, in Nigeria. There are some countries in West Africa where we, as Transaid, have done some research previously where the situation is slightly different. For example, in Ghana, motorcycle taxis are not legal. But I think we'd probably anticipate that to change over the years. And obviously, I think in East Africa, we saw that rapid growth and us trying to catch up in response to that rapid growth. I think the important factor is that motorcycle taxis are everywhere, or they're going to be everywhere, and that the quicker we can step ahead of that and ensure that it grows in a safe and sustainable way, the better. And I think that's really up to donors to actually consider that going forward. I'm going to read out one last comment before we close. And this comment comes from, Mr. Patel again. Despite multiple attempts by the government to regulate the Boda Boda sector, it remains largely informal and inadequately regulated. The National Transport and Safety Authority, the National Transport and Safety Authority regulations of 2015 and the establishment of the Boda Boda Task Force in 2019 were the only steps in the right direction, but more needs to be done. Absolutely agree. Our feeling, as you don't no doubt know, Mr. Patel, the NTSA, the National Transport and Safety Authority, moved from the Ministry of the Interior, which is where the Boda Boda Task Force was created in 2019, to the Ministry of Transport after the elections in 2022. And in recent meetings, we've since sort of discovered that the Boda Boda Task Force is no longer, unfortunately. But I think what we'd like to achieve is that the coalition is a replacement for that. Our ambitions, our objectives are aligned with the Boda Boda Task Force and with government. And I think bringing stakeholders in from multiple sectors, including the private sector, civil society, the wider associations, and also the government, I think we're in a good position, I think, going forward. And also with the forthcoming announcement of the National Road Safety Action Plan, which we hope to see very soon. On that point, I'd like to say a big thank you to Dr. Gladys Nchao. I'd like to say thank you to everybody involved in this study, and thank you to everybody for attending today. And we will, if there are other questions, please keep them coming, and we'll continue to respond to them offline. And Mr. Patel, love to be in touch with you at some point. But thank you very much. Our contact details you can see down in the bottom corner there. Please do feel free to get in touch if you have any further comments that you want to make directly. Thank you, everybody.